Yes, doctor, you can continue now.
Okay. Vacuum-assisted breast biopsy. What can we do during an active bleeding and during a vasovagal syncope in order to complete the procedure? Learning objectives are to know the management of an active bleeding during a vacuum-assisted breast biopsy with blood clots in breast sample, which difficult the visualization of amorphous microcalcifications, and to know how to revert a vasovagal syncope during a vacuum-assisted breast biopsy, especially in the upright position. Vacuum-assisted breast biopsy is a minimal invasive procedure in which a suspicious breast sample is removed with a vacuum pump through a small skin incision under local anesthesia. Our topic is mammography guiding in the upright position where the patient is seated. Radiologists analyze the projection in which the lesion is nearest to the breast, to the skin. With a biopsy guidance system with tomosynthesis, it is possible to locate exactly the depth of target lesion without requiring triangulation. Once needle is on target, notch is opened, and the rotating CAT device removes breast tissue, which is carried to a tissue collection receptacle. Most common complications are hematoma and a vasovagal syncope. These are the 5 images required: target localization, pre and post-fire, specimen radiography, and the post-clip to certify the clip placement. Other complications are pneumothorax, active bleeding, suboptimal tissue samples, breast implant damage, as limitation, coagulation disorders, patients' inability to immobile, overweight, and positioning problems. Vacuum needle can be used in the suction the blood out of the skin during and at the end of the procedure. Immediately after biopsy, needle is withdrawn from the breast, local focal compression on biopsy site is performed to achieve hemostasis. Other overcoming difficulties are targets less than 10 millimeters away from the skin, with a minimum notch of 12 millimeters, and thin breast, compressed breast less than 30 millimeters thick. Part of the notch is out of the skin. With roll views, we generate more depth to the target and more thickness to the breast. In addition, local anesthetic may be injected into the breast parenchyma to increase its thickness before biopsy probe being fired. For superficial lesions, petite biopsy needles with 12 millimeters of notch with a smaller biopsy aperture may be used to avoid cutting the skin. In the DVT post-biopsy image, we measure the distance from the marker clip to the skin, comparing it with that has been measured in the DVT target. This is an example. A right lateral view. In the first breast compression, the notch would be outside the skin at 5 millimeters. With roll view, we placed target 15 millimeters away from the skin. This was an invasive ductal carcinoma. During an active bleeding, especially in dense breast, we put the needle in lavage function, in which The notch remains opened in the post-biopsy stereotactic pair, avoiding high density of the breast clots. Ice is applied with manual compression to then gradually decompress the breast, preventing clip displacement. This is another case, a 45-year-old patient with previous breast cancer surgery. 1 year later, we found a new group of pleomorphic microcalcifications located at 12 o'clock. A post-fire image reveals an hematoma with an air cavity which displaced the projection of the selected target. Unobscured microcalcifications because the blood clots density. A second post-fire image with a needle in the lavage faction notch remains open, passing physiological saline and aspirating the blood clots. In this picture, we are comparing the target selecting and the breast tissue. During a vasovagal syncope, the greatest risk is the compressed breast once the needle is in target position. When patient refers shortness of breath, dry mouth, immediately we measure blood pressure and begin to compress the calves manually or with the cuff of the sphenomagnetometer in order to prevent the vacuum-assisted breast biopsy discontinuity. This is an example. We are compressing the calves. As conclusion, knowing what to do during a vacuum-assisted breast biopsy with an active bleeding or with a patient with a vasovagal syncope allow us to successfully complete the procedure, avoiding an insufficient breast sample and its suspension. Thank you.